This medication is used to prevent or treat eye infections and to treat swelling in the eye. It contains an antibiotic, sulfacetamide, that stops the growth of bacteria, and a corticosteroid, prednisolone, that reduces inflammation. It treats only bacterial eye infections and will not work for other types of eye infections. Unnecessary use or overuse of any antibiotic can lead to its decreased effectiveness. The daily dosage and optimal timing of using this medication should be consulted with a healthcare professional. Before using Blephamide suspension, drops, wash your hands and shake the suspension well. Make sure the product has not darkened in color before using. Do not wear contact lenses while using this medication and avoid touching the dropper tip to prevent contamination. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Place one drop into the eye and gently close your eyes for 1 to 2 minutes. Do not blink or rub your eyes. Repeat the process for the other eye if directed, and do not rinse the dropper after use. If using other eye medications, wait at least 5 minutes between applications. Use this medication regularly to get the most benefit and continue use for the full time prescribed, even if symptoms improve. Do not stop the medication suddenly without consulting your doctor, as your dosage may need to be gradually decreased. Inform your doctor if your condition does not improve after 2 days. When using Blephamide suspension, drops, you may experience a temporary stinging or burning sensation in your eyes for a minute or 2. You may also notice eye discomfort, dry eyes, tearing, itching, or redness. If these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, using this medication for a prolonged period of time may increase your risk of developing a new type of eye infection. It's important to follow your doctor's prescribed dosage and contact your doctor if you notice any new or worsening symptoms. Be sure to notify your doctor immediately if you experience any serious side effects, such as changes in vision, eye pain, staining of the eyes, signs of infection, easy bleeding or bruising, yellowing of the eyes or skin, or dark urine. While a serious allergic reaction to this medication is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before using Blephamide suspension, drops, make sure to inform your doctor or pharmacist about any allergies you may have to sulfacetamide, prednisolone, sulfa drugs, or corticosteroids. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have any eye problems, have had eye surgeries, or if you have diabetes. After applying this medication, your vision may become temporarily blurred or unstable, so it's advised not to drive or operate machinery until your vision has cleared. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unknown if the medications in this product pass into breast milk, so consulting your doctor before breastfeeding is recommended. It's important to be aware of potential drug interactions with Blephamide suspension, drops. Some products that may interact with this medication include gentamicin, certain local anesthetics, such as tetracaine, and preparations that contain silver. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone accidentally swallows Blephamide suspension or experiences serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Always keep this medication out of reach of children and pets to prevent accidental ingestion. Do not give this medication to anyone else. This medication has been prescribed specifically for your current condition. Once your treatment is finished, discard any leftover medication. Do not save it for future use unless instructed by your doctor. If you are using this medication for an extended period, more than 10 days, it is important to undergo regular medical tests, such as eye exams. Make sure to attend all scheduled medical and lab appointments. Speak with your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Blephamide suspension, drops at room temperature, away from light, and do not freeze it. Make sure to keep it out of reach of children and pets, and do not use the solution if the color has darkened. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard it when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.